So this is the fundamental of psychiatric mental health nursing. So first of all, we have to go some terminology about the psychiatry. So there are two primary characters of personality, mental and behavioral disorder. So all of the problem, whatever it is, personality disorder, mental disorder, or behavioral disorder, we have to categorize these two in two types. One is called organic disorder, other is called non-functional disorder or functional disorder. Organic disorder, what it is, what does it mean, organic, and what does it mean, the functional disorder, what does mean, right? Organic disorder is a form of decreased the mental function. So mental status or mental function decreased, impaired due to medical or physical disease. So impairment of the brain function because of any pathological cause, physical disease in the brain. So rather than a psychiatric like dementia or any other pathological disease like meningitis or encephalitis, right? Meningitis simply inflammation of the meninges because of any infection, or encephalitis, or like if the patient have any kind of brain function is impaired, like ammonia level is increased because of liver abnormalities. Ammonia is a gas what is metabolized if the liver work well, but if liver does not work, ammonia accumulate and ammonia go enter inside the brain and brain function will be impaired. It is called hepatic encephalitis. So if the brain tissue does not get enough oxygen, also brain function will be impaired. Or if any brain injury or chronic drug abuser, alcoholic person, their function of the brain will decrease, impair of the brain function. So there are underlying cause, right? And brain does not work. And this is called organic disorder. Organic disorder. Whereas the functional disorder is a form to decrease the mental function with no known organic basis. So brain function is impaired or decreased, but there are no known organic cause, right? No organic pathology. So in a form decrease the mental function with no known organic basis, but are believed to be the result of psychological factors such as emotional conflict or stress. Example include antisocial behavior. So the person who have a problem with antisocial or personality disorder, if you examine their brain like MRI or CAT scan or any other laboratory test, we will not evaluate, we will not exclude any abnormalities in MRI or CT scan or CAT scan. no underlying pathology is there, but patient have a problem in the brain, decrease the brain function, okay, psychological problem. So believed to be the result of psychological factor such as emotional conflict or stress. So it is true, the functional disorder does not have any pathology, but then some factor can increase the disease, like stress. Stress can cause anxiety, and anxiety, if it persists for a long time, patient develop psychological problem. So what are the psychological problem? Antisocial behavior or phobia. Phobia also the psychology. Some people has a height phobia. Some people has a narrow space phobia, right? So also allow us to see, hear, smell, taste, and feel. So when we examine a patient who have the psychological problem, we have to examine their taste, their hear, their smell, their feel. So as I told you, like patients are schizophrenic. Schizophrenia patient have abnormal belief with perception. So this abnormal belief might be hearing, might be some taste, might be smell, might be they feel something abnormal. As an example, I want to tell you the person who is schizophrenia, who have hearing hallucination, they can hear something, but you do not hear it. Other person do not, but they will hear something, and they do according to the verbalized hallucination or hearing hallucination. Somebody telling them do that, do this. They have sometimes abnormal perception, sensation, their body, smell also. So now here, personality disorder are characterized by poorly adaptive personalities who demonstrate impair the social functioning. Personality disorder type: antisocial, narcissistic type, or masochistic type, or obsession compulsive type. So antisocial, this is a chronic antisocial behavior. Basically, this is the personality disorder. So in which the right of others are violated. So the person who are antisocial type behavior, they thought everybody is wrong or they doing wrong. He only the right. They have a strong abnormal belief. Narcissistic type means they think they are all in all, and you have to always tell what good about them. So interpersonal problem, interpersonal, arise due to the inflated sense of self-worth. They thought they are all in all, right? So obsession, some people has a obsession. They do same thing, repeat and repeat again and again, again after again, same thing. And if you stop to do the same thing, their anxiety will increase. So they do this to reduce their anxiety. So this abnormal thinking and doing to reduce the anxiety, this is obsession. Repeatedly do this, and when do this physically, this is called compulsiveness. Obsession and compulsive disorder. This is also the personality type of disorder, right? So here, what is psychosis? Psychosis is a broad term that covers many different symptoms. Common symptoms including in psychosis are hallucination, delusion, or difficulty of filtering or difficulty of doing the ordinary things. So if I want to share with you what are the difference between hallucination and delusion. Hallucination, abnormal belief with perception, but delusion is abnormal belief, strong belief, but is not normal. So what are the definition they wrote? False personal belief based on incorrect perception, but reality which are inconsistent with the culture and previous belief. Hallucination means abnormal belief with perception. This perception either hearing or watching or seeing or feeling, smelling or taste. Both are abnormal, and both are abnormal trust or belief with strong feelings. So feelings overwhelming by sensory information, difficult filtering stimulation from the environment, and difficulty doing ordinary things, and periodic difficulty with understanding or functioning in what the most individual do. So now go the second portion of this PowerPoint, right? And this portion we are going to talk about the relationship. What are the relation with you and the psychiatric patient? So what are the principle of the relationship between you and the client? In this section, we are going to give a focus only the LPN or RN with a psychiatric patient, right? So when you deal with the patient, you must have to respect their opinion. What is right or wrong, it does not care. So always you have to do something good for the patient. So it would be beneficial for them. And we have to be truthful to our profession, right? So whatever their mental patient or any patient, regardless of their disease, their religion, their race, their nationality, we will be fair and they will be equal to us. So when you dealing with them, you have to be honest, respect to them, show empathy, and understand the characteristics important to the development of a therapeutic relationship between you and your client. The client should be cared for in a holistic manner. Holistic manner means you have to give a complete service. Spiritualities, medication, physiological, and psychological demand. The nurse consider the client cultural belief, yes, what they believe and what you believe. If it is not same, also you have to respect their trust or their belief. If my belief give me the peace, and if I'm not harmful for anybody, so what is your problem? What is my trust, my belief? It is inside me. Yes, it is my responsibilities, accountability to respect my patient, whatever their culture, whatever their religion. Appropriate limit and boundary define and facilitate the therapeutic nurse-client relationship. Honest and be open communication. So when you make a friendly relationship with your client, they will trust you, and when they trust, they will verbalize their emotion, their feelings, and you take a good medical history, and good medical history can help for appropriate diagnosis of the disease. What else? So the nurse use the therapeutic communication. So when you communicate with them, it must be productive, effective, right? So therapeutic communication is very important with your patient. The nurse respect the client confidentiality and limit the discussion of the client to the members of the treatment team. The goal of the nurse, the client relationship is to assist the client to develop the problem solving and coping mechanism. So what the patient problem? You have to educate them how to coping with the system. As I told you, there's so many problems in psychiatric or the disease. I want to give you two easy examples. Like a couple or somebody lost their partner, husband or wife, anyone is lost, die. So you talk to them, try to find out what are the anxiety, give them space to verbalize their emotion, and tell them to do something so that they can adapt with the environment, and this is called coping mechanism. So like a patient, when keep them busy in a group work, some music, some exercise, yoga, group work, it is coping mechanism, but you have to find out which one helps them, right? The nurse need to consider the culture, religious, spiritual practice of the client, and whether this practice may give the client hope, comfort, support, or healing their disease process. But always keep in mind, don't give any false hope. No, what is truth, you have to tell. But never go with any kind of argument with your psychiatric patient. So now go here. What are the phase of therapeutic relationship. So the phase begins before the nurse first contact with the client. This is where the nurse established the purpose, the goal, and objectives for interaction. So when you are going to deal with a patient, you know your patient is an obsessive compulsive disorder. So you have to have a purpose. This is the reason I'm going to talk. This is my target for my patient, how to improve their mental condition, how to figure it out and find out their underlying cause of the disease and give a pathway to find out and solving their psychological issues. So the nurse thoughts the indeed phase to focus on his or her own preconceived ideas, stereotype nature, bias, values, right? So as I told you, some psychological patients have a abnormal belief, abnormal thought, or abnormal perception, and they bias by something like I'm hearing something by God and I'm biased. And because of their abnormal thought, they will be biased. Orientation or introductory phase, basically acceptance, trust, boundaries. So when you talk to them, you have to introduce yourself. You have to talk that way. You can make a trustable relationship with your patient, and you have to be accepted by them. Definitely both parties have to follow their boundaries, their limitation. So also expectation and the time frame. So because of your experience, your skill, your academic knowledge, or evidence-based practice, when you're dealing with one patient with a particular disease, you have to think, imagine what are the timeline this patient will be cured. At least you have to predict. So always a doctor or healthcare provider or nurses, they can predict about the time, how long they will be okay. Client-centered goals. So when you work with the patient, our main focus oriented or focus only to the patient. And termination and separation of the relationship are discussed in anticipation. So when we do something before ending, it would be easy for everybody to adapt, means copying. So what next? So therapeutic nurse working phase, termination or separation phase. Working phase basically exploring, focusing, or evaluating the client concerned and problem occur. An attitude to acceptance and active listening. So when you ask something to your patient, give them time to organization their thinking Give them time to verbalize their feelings and keep yourself silent. And this silent means you are interesting to listen them. You caring them. Willingly you want to listen them, right? This is the comfortness for your patient. Whatever it is, we always encourage our client. So select all category question in NCLEX board. If you get anything encouraging, positive, long sentence, this will be the answer. So what is your roles regarding termination or separation phases? Prepare the client for termination means before discharge from hospital. If you are too much caring, your patient fall in love with you. It's also problem for your patient to coping. Nobody care them in their family, but you care. So always we have to have the limitation. Too much good is not good. Too much bad, definitely worse. Evaluate program progress, because if you go in the nursing process, first is admission or analysis, right? Then we go for diagnosis. After taking the history, we have to go for the planning. Then we implement our planning or implementation, intervention. After that, we go for evaluate. So evaluate is a process of, evaluate is a one steps of nursing process. Because after the evaluate, we have to target our next goal, right? Identifying the responses related to termination and separation, encouraging the client to express the feelings, identify the client's strength, and anticipate the need for follow-up. Also, we have to refer the client for any organization, any resources, or social worker for any kind of support. Now go for family as an extension of the client. There are two notes you have to keep it in mind. Always try to get involved your patient about their care or their daily living activities. If patient go at the home, that times you encouraging the family member to get involved in patient rehab or caring. Family members should be viewed as a collaborating manner. Also, competence and carrying the focus towards the family member. Nurse have a professional obligation, right? Always we have some professional obligation. So also have a professional obligation to aware of and also sensitive to the culture, ethics, religion, right? So educating family member, easy to cope, easy to understand. Regarding the client illness, identification of the symptoms, effective management, it is very makes sense. If the family member are educated, it would be easy to get understand. It is easy to coping. But whatever we do, we have to try to demonstrate or remodeling. Just you do something like example, you showing the patient or family how to withdraw the blood for blood sugar estimation. Then tell them, can you do this? And you see, and this is called remodeling or demonstration. Now, therapeutic communication process. What are the principles of this? Communication include verbal or non-verbal. So when you talk, this is verbal, but your body language, your, like you are writing on the board, you are showing something, picture, this is also part of communication, right? Successful communication include appropriateness, effective, flexible, and also the feedback. Anxiety is anxiety in the nurse or client impede the communication. So definitely anxiety increase the impulsiveness, right? Whatever we want to do, if you have too much anxiety, we do wrong. And after doing wrong, we will think. So communication must be goal directed in our professional framework. So now we have to go for some mental health issue. Mental health is a lifelong process. Most of the mental problem patient has to carry out. When you give them medication, it will be under control. Or one or two times acute exacerbation of chronic disease. So mental health is a lifelong process. So mentally healthy individual is in contact with reality. So mentally healthy individual, so like you and me, if we are mentally okay, we have a contact with reality. Nothing abnormal belief or cinematic, filmy, not reality. But the psychiatric patient or mental health problem, they do not have any relation with realities. This is the problem. So mentally health individual has a psychological reliance. So psychiatric mental illness, what is basically? Psychiatric illness is a loss of ability to respond to the environment. So you see, the psychiatric patient are not social. They like to isolate them. Either they do not talk, but if they talk, it is too much. Talkativeness. They sometimes sad or they're too much happy. They cry. They do not eat well. They does not maintain the personal hygiene. So illness is a loss of ability in response to environment. It is characterized emotion, thoughts, or behavior pattern that impair the functioning and cause the distress. Personality characteristics, especially psychiatric mental health illness patient, they are self-centered. But yes, you know, so many successful persons are self-centered, but this is constructive. But the mental health problem patient, they are mental centered, but this is destructive. This is bad for their brain because their thinking is abnormal. So what you are thinking, it is important to think first what I'm going to thinking in absence of my mind. Perception of strength or weakness will be unrealistic. Also, the abnormal thoughts or perception may not be reality based, right? So what you thinking and what are the perception, both are no relation with reality. Ability to find the meaning or purpose in life may be impaired. I'm thinking everybody is wrong, but I am only who is right. This is problem, right? But I said, this is my abnormal belief and I'm following my abnormal direction. And my abnormal thinking is so strong, nobody can remove me from my thinking. So also the life direction or productivity may be distracted, because when I'm thinking ill, my performance will go down, social relationship go down, personal relationship go down. If you take my professional history, my working history, it will be so bad. Also, meeting someone one's need may be problematic. Excessive reliance or preoccupation on the thoughts, opinion, action, all abnormal. So adaptation to the stress. So individual sense of self-control may be affected, or perception of environment may be distorted. So coping mechanism may not exist or may be ineffective. So when we go to the doctor or when the psychiatric patient get hospitalized, when the coping mechanism does not work, like I have a abdominal pain, I will be try to control. I will try to not to go to the emergency. I will try to some medication from over the counter. But when I see no, it is too much, my body does not adjust with this, coughing is not work, call 911 and I go. But if I have a psychiatric patient, I have an abnormal belief, I'm totally isolated, I'm not cooperative with anybody, does not maintain my personal hygiene, so I'm crying or depressed, suicidal ideation. I do not know it is my problem. I'm sick. Maybe my family, they thought this is abnormal and called 911 and got hospitalized. So my coping mechanism is failed. At the beginning of the disease, maybe my family organized the counseling, psychotherapy, but if it is not effective, disease leads to the more deteriorate. Then I have to go in the hospital. So the most of the psychiatric patient, interprofessional relationship breakdown, right? Personal relationship, their family relationship, relationship with a co-worker, everything is breakdown. So interprofessional relationship maybe minimally existent and also be negatively affected. Ability to enjoy, sustain intimacy in a relation is impaired. It depends. This depends what type of psychiatric problem. If the patient are mania, sometimes it's different than the depressed patient. So coping mechanism. So coping is a defense mechanism, right? Whatever psychological or any physical problem, our body always try to adjust with a coping system. So coping involved any effect to decrease the anxiety. Coping mechanism can be constructive or destructive, right? So also cognitively oriented in an attempt to neutralize the meaning of the problem. It is a coping is a defense mechanism, right? Defense or emotionally oriented, thus regulating in response to protect oneself. What is the other defense mechanism? Anxiety is also type of defense mechanism. At the very beginning, mild anxiety. You have anxiety because of your licensing exam. It is not bad. Because of this anxiety, you can study more. You will try to use your time productive way. But if anxiety is mild or severe, your performance will go down. Nothing will work. Your brain will not work. So an anxiety increase or individual coping by using the defense mechanism. A defense mechanism is a coping mechanism used in an effort to protect the individual from feelings of anxiety. As anxiety increase and become overwhelming, individual coping by using defense mechanism to protect the ego and decrease anxiety. So coping mechanism or defense mechanism, both we used to decrease our moderate or severe anxiety. So what is our role regarding coping or defense mechanism? Always assist to the client to identify the source of anxiety. Assess the client use of defense mechanism. Facilitate the appropriate use of defense mechanism. Determine whether the defense mechanism used or avoid the criticizing. Definitely we will not do this. We have to encouraging my patient. We do not talk any negative even behind of them, right? Always do something good for them. Do not do any harm, not a harmful for them. What is beneficial, we have to follow. Truthful, honest. So this is the part of our principle of ethics. Diagnostic and Statistical Manual of Mental Health Disorder. So for the psychiatry patient, we have one association. It is called American Psychiatry Association. They have some criteria to diagnose the disease, care of the patient. This criteria we use for any clinical diagnosis, any research purpose, any educational setting, or included diagnostic criteria are included for each mental health disorder. So this guideline provided by American Psychiatry Association or hospital or agency have to follow, right? So this guideline is manually assess the healthcare team for planning, for evaluating, and for treatment plan. Some of the patient is diagnosed by more than one disease, and this is called comorbidity. So what is comorbidity or co-occurring disorder? It's a dual diagnosis of the disease. Refer to the client who has both mental health disorder and a substance related disorder is called comorbidity. So some of the terminology we have to know about the psychiatric patient regarding admission and regarding the discharge. Like I have a fever and then I want to go to hospital. I will share with my family, or willingly I have to go to hospital for admission. But the psychiatric patient, they do not know they are sick. They does not aware about their sickness. So they do not feel they have to go to hospital. So in that case, maybe somebody push them to go. They don't want to go to hospital, right? So when somebody forcefully or technically get admitted them, so when willingly patient go to get hospitalized, it's called voluntary admission. But if the patient do not want to go to hospital, but they are so bad condition of disease, they are harmful for themselves, they are hyper or aggressive for the others. If they need to go to hospitalized without their willingness, this is involuntary hospitalization, right? So what is voluntary admission? The client look for admission for the care. Voluntary client is free to sign out, right? Sign out to the hospital with primary care provider. Also, they voluntarily the client again his or her will is termed false imprisonment. The civil rights are trained fully by the client. So what else? Right of confidentiality. So it is our ethics. Always we have to keep the patient record, not to share with others. Privacy maintaining. So we have to follow one of the guideline. It is called HIPAA, HIPAA. HIPAA stands for Health Insurance, Portability, and Accountability, right? So according to the Health Insurance, Portability, and Accountability, we have to keep the confidentiality for the patient. So a client has a right to confidentiality regarding his or her medical information. And this Portability or Protection Act by this organization is called HIPAA. information sometime must be released in life-threatening condition. Yes. So in the events of a specific threat, again, an identified individual, the healthcare professional has a legal obligation, right? Except in emergency condition, the client information can be released only with the client's informed consent, with a specified information that can be released and the time frame for which is release is valid. In voluntary admission, what it is? Involuntary admission may be necessary when a person is mentally ill or is a danger to self or danger to others, or is need of psychiatric treatment or physical care. Involuntary admission occurs when a client is admitted or detained involuntarily for the mental health treatment because of actual or imminent danger of self or others. So, as I told you, the psychiatric patients do not have any relation with reality. They are psychological problem, but they do not believe they have a problem. So they never feel they have to get hospitalized. They has to take some psychiatric medication. If the psychiatric disease is not treated, in that time it leads to danger and it leads to the harm by its themselves or it is threatened to others. Because of safety, it is our duty to push them or call 911 for hospitalization. Some example, a patient is depressive. Depressive patient has a ideation of suicide. If you do not hospitalize them, any times they go for the attempt for suicide. So in that case, it is involuntary admission. The client who is admitted involuntarily retain his or her right for informed consent. The client retain the right to refuse the treatment, including medication, unless a separate or specific treatment. But in some life-saving condition, healthcare provider can do this, right? So the client loses the right to refuse the treatment when the client is possessed an immediate danger to themselves, danger to others, and also the order form a judge is required for involuntary admission. Expect in the case of emergencies, right? And also which allowing the time to obtain the necessary order from a judge. In the case of all involuntary admission, the legal counsel must be provided for the client. A court hearing is held by the judge within a specified time for the client admitted involuntary. What else? What are the next information we have to know for involuntary admission? In most of the states in United States, the client can institute a court of hearing, or at the court hearing, the determined is made as whether the client may be released from hospital or detained for further treatment. The client has a right to the treatment in least restrictive treatment. Least restrictive treatment environment. So if the treatment objective can be achieved, for example, by court-ordered treatment to an outpatient facility as opposed to an inpatient facility, the client has the right to be treated in outpatient setting, right? And also here, in the course of providing the nursing care or carrying out the medical prescription, if the nurse believes that a client lacks competency to make the informed decision, action should be initiated to determine if a legal guardian needs to be appointed by the court. So what the next? The type of mental health admission and discharge. So now we are going to give a focus about the discharging from hospital, trace out about the release from hospital. The client, sometimes patient willingly want to leave the hospital. It is patient right, I want to go. So the client may be released voluntarily against the medical advice or with a condition. The client who should voluntary admission has a right to be released upon the request. Who wants to stay in hospital? Nobody. So nobody want to get sick. Nobody want to get hospitalized, or nobody want to get admission in the hospital. Voluntary release in absence of an act of self-harm or danger to others. A voluntary client should never be detained. If the voluntary client wishes to be discharged from the treatment but is considered potentially danger to self or others, the primary healthcare provider can prescribe the client to be detained while the legal proceeding for involuntary status are right. So voluntary release. Some states provide the conditional release of involuntary hospitalized client, right? So also this enable of the treating the healthcare provider to prescribe continued treatment on an outpatient basis as opposed to discharge from the client to follow up on his or her own initiation. So an involuntary client who is released conditionally may be re-institutionalized while the competent is still in effect without recommendation of formal admission procedure. Discharge planning and follow-up care. So discharge from the hospital and follow up what they should do and what they will do for the future for follow-up. Discharge in is the termination of the client institution relationship. This unconditional release may be prescribed by psychiatric or by the court or administration for involuntary admitted client and may be requested by voluntary client at any time. In most states, the client can institute a court hearing to look for an expedient judicial discharge. And discharge planning and follow-up care are important for continued well-being of the client with a mental health disorder. So some of the patient need some particular therapies to improve their disease, right? So what they are? Basically, one of the therapy in usually patient need is called melotherapy. So melo refer to the physical or social environment in which an individual is receiving the treatment, right? So in this therapy, the safety is most important or priority in managing the melo. So all of the members of the treatment team contribute to the planning and functioning of melo and are significant and valuable to the client successful treatment outcome, right? The team generally include RN, social worker, therapist, and recreational therapist, psychologist, psychiatrist, occupational therapist, and also clinical nurse specialist or nurse practitioner. So psychologist and psychiatrist. Psychiatrist, basically the doctor, physician who diagnose the disease and prescribe the medication. And psychologist, they can analyze the disease, they can diagnose the disease, they give the counseling, they give the psychotherapy, psycho counseling, but not allowed to give the medication. Some are exceptional, but the 100% medication or prescription are able to write by psychiatrist. But basically, in this group therapy, we make group by different profession like psychiatrist, psychologist, therapist, social worker, clinical nurse specialized, or nurse practitioner, all combination work. And continuation, the committee meeting or activity groups or social skill groups, physical exercise groups. So every patient in one group, and this group or 2 or 3 groups, the groups has to participate in same type of activities. Like early morning, they has to go together for the breakfast. Then they go for some light exercise. Then they go for in a room for watching TV. Then they go for participate in any game. or like music and dancing, recreation, or any other social activities. One-to-one relationships are used to examine the client behavior, feelings, interaction. The focus of melotherapy is a empower the client thoughts in voluntary setting his or her own goals and develop the purposeful relationship with the staff to assist in meeting these goals, right? So um, okay, so now we should talk the type of therapy of care, some interpersonal psychotherapy. So interpersonal psychotherapy, a treatment modality that uses a therapeutic relationship to modify the client feelings, attitude, behavior, and work within a agreed upon the time frame to help the meet of the client's goal. So the therapeutic communication form the foundation of therapist the client relationship, and this relationship is used as a way for client to examine other relationship in his or her life. So what are the supporting level of psychotherapy? Supporting level. So always brief therapy or may extend over a period of years and allowing the client to express the feelings, explore alternative way of treatment, and make the decision in safe or caring environment. So definitely caring environment, make decision, exploring the alternative of treatment, all are supportive level of psychotherapy. So no plan exists to introduce the new method of copying, right? And also instead, the therapist reinforce the client existing coping mechanism. So what is re-educative level of therapy? So if you go and have a look at the terminology, re-educate means if you reinforce your patient, right? I mean, you have to redo it. You have to demonstrate it or remodeling it. So the client is explore alternative in planned, systematic way to approach the goal or require a longer period of therapy. It depends upon diagnosis, treatment plan, prescription, and everything is came out after the group meeting. Everybody be participate. The client agree upon a specific desired changes of behavior or learning a new way. Techniques may include the short-term psychotherapy, so or any reality therapy, cognitive restricting, behavioral modification. So psychiatry treatment, not only the treatment by medication, pharmacological. Sometimes we give them psycho counseling, sometimes with them psychotherapy, then go for psychopharmacology. So reconstructive level of psychotherapy, emotional and cognitive restricting of self taking place, positive outcome, and other behavioral therapy here. And what else? Behavioral therapy, basically a treatment approach that use the principle, right, or also the operant, the conditioning or classical conditioning behavior therapy to bring about the behavioral change and believe is the most behavior are learned. So some of the psychiatric patient has a behavioral abnormalities. So by the good training or by repeating direction, they are be able to change their behavior and they learn. So the classical condition, the individual responds to a stimuli, but it's basically a passive agent. But the operant conditioning refer to the manipulation of the selected reinforcer to elicit and strengthen desired belief behavior response, which is defined as anything that increases the occurrence of behavior, right? Another behavioral is called desensitization, aversion, or modeling. So desensitization is a form of behavior or behavioral therapy by which exposure to increasing increment or fear the stimulus paired with increasing the level of relaxation, and increase the level of relaxation help to reduce the anxiety, help to reduce the fear, or adjust or coping with them with their problem. Aversion relationship. Aversion, what does it mean? To form a behavioral therapy by which the negative reinforcement is used to change the behavior, right? Like example, a stimulus attractive to the client is paired with an unpleasant event in hope of enduing the stimuli with the negative properties, thereby discouraging the behavior. And modeling behavior means you do something and then tell to do same thing, right? So modeling is a behavioral therapy in which the therapist act as a role model for specific identification behavior so that the client learn through the imitation. So what I do, they should repeat, right? When I'm doing something, it is modeling. And when you tell them to do same thing, it is remodeling. Or when you do something, on when you tell something, if they do same absolutely same thing, this is called imitation. cognitive therapy. Okay, what is cognitive therapy? So an active, directive, or time limited or structural approach used to treat a variety of disorder, including anxiety or depressive disorder. So cognitive therapy, you see, what is cognitive therapy? Active, directive, time limited, structural approach. This approach used for the treat a variety of disorder, including anxiety and depression. So you have to organized planning and improvement with the time, structural, patient participating for the any particular psychological disease. It is based on principle that how individuals feel and behave to determine by how they think. Also think about what? Think about the world or reality, right? So cognition are based on attitude. Attitude about what? Attitude to develop from previous experience. Therapeutic techniques are designed to identify the behavioral problem or reality test, correct distorted conceptualization, right? Or dysfunctional belief underlying this cognition. So therapists help the individual to change the way he or she thinks. Therapists find it out what is the abnormal thinking. Psychiatrists give a counseling or psychologists give a counseling, try to catch up the problem and also snatch them from this abnormal thinking. But never go for argument. What you are thinking is absolutely wrong. Don't sell that. Better when a patient tell, I can see a spider on the wall. Nobody can see the spider on the wall. But you don't see directly, oh no, there are no spider. If the patient has a complaint, I can see the spider on the wall. You tell them, let me see. Then you check everything. Then you can tell, okay, you are thinking, but after a clear observation, I do not see anything. Can you tell what the color or what you are actually seeing? Right? So don't directly say, no, you are wrong. So group development or group therapy, it is also the part of melotherapy. Group therapies involve a therapist and also ideally the 5 to 8 member in a group, right? And this therapist can give them treatment. And definitely every member has to actively participate. If anybody need one-to-one, we have to separate them, but we will also train them coping with the group. Individual development of group involve the superficial rather than the open or trusting communication. Involve superficial rather than the open. Members become, so also it is very important when you interact with the member, we have to be equal to all. Like in a group member, the 5 member, if you give a counseling, 5 minutes for every patient. It does not mean that you give one patient 20 minutes, another patient 3 minutes or 5 minutes. Equal. Member maybe aren't clear about the purpose or goal of the group, but you have to explain. The work of the termination begin and is expand upon the throughout the duration of group, right? So group development and group therapy, working in a group, termination in a group. Working in a group. The real work of a group in a accomplished or member are familiar with one another, both conflict and cooperation surface during the group, and termination of the group basically begin with the initial meeting. Member feelings are explored, encouraging their accomplishment. So group development and group therapy. So group development and group therapy basically self-help or support group. Support groups are based on peers that individuals who have experienced a problem are based to help others who have a similar problem. And family therapy. So some of the psychiatric patient like autism or ADHD, you have to also educate the patient how they will behave with the patient, right? The family therapy is a specific intervention mode based on the premise that the member who have a presenting symptom will signal the presence of problem in the entire family. And this premise also assume that a change in one member will bring about the change in others. The therapist work to assist the family member to identify and express their thoughts and feelings. Therapist can find it out, right? The abnormal things or behave and define the family roles. Try new, more productive style of related or restore the strength of the family. So